We will first mark the utility wire made out of 016 by 016 stainless steel arch wire with a white marking pencil on the distal of each lateral incisor bracket. We'll use an angle half plier in this case to make the anterior step. The width of the beak is approximately 3 to 4 millimeters, and it is a very nice distance for the anterior step to be made. We will now grab the anterior segment of the wire and bend the anterior step out laterally. This will avoid the tissue. With utility arch wires, the lateral tissue impingement is one of the major problems. We'll now use a ruler to measure from the mesial of the lower molar tube to the distal of the lateral incisor bracket and transfer this to the utility arch wire. This will give us the position of the posterior step. Again, using the half plier, we will make the posterior step with an approximately 30-degree molar tip back. We will do the same on the left side. This is used when the utility arch wire is going to have the posterior step placed right against the lower molar tube. These are the cases that you would like advancement of the lower anterior teeth and molar tip back for gain in arch length. We will now check our torque in the arch wire. We would like a slight lingual crown torque on the lower incisors. In the posterior, we would like a buccal root torque, which is present in this wire. To add to the buccal root torque, we can twist the wire, grabbing the anterior portion of the buccal sweep. You can adjust each side now for the amount of tip back. Again, we would like it approximately 30 degrees in an 016 by 016 arch wire. Make the buccal sweeps wide, for again, this is where the main problem with tissue impingement lies. Now we must size the arch wire, and to get started we know that the posterior step is up against the lower molar tube. So we can make a cut approximately 8 to 10 millimeters posterior to that posterior step. Now we will size the arch wire using a distal end cutter. But in some cases the tissue is too close to the distal end of the molar tube. Therefore we have to remove the wire and make the necessary adjustments outside of the mouth. Due to the activation of the molar tip back, the anterior segment will be gingival to the incisor brackets. The wire must be raised incisally to engage the bracket slots. This will cause intrusion on the lower incisors and molar tip back. The arch length will be gained by the molar tip back and by some advancement of the lower incisor. We will now tie in the arch wire, as usual, using elastic ligatures or steel ligatures as required. You may run into difficulty if the anterior step is too close to the lateral bracket. We would generally like to have 1 to 2 millimeters of room with the arch wire onto that bracket. Otherwise, it makes tie-in very difficult of the utility arch. This anterior step was made a little bit close to the lateral bracket. Now we'll use a tweed plier to add the tip back and to flare out the lower buccal sweep. Our next patient has had an upper utility arch in and is presenting back for a monthly adjustment visit. We will remove the ties, and in this case we will take out the utility wire to check it for activation. We usually do not do this. Usually we will leave the utility wire in for an extended period of time. But once in a while you may want to remove the wire just to check it. This wire had a tie back with a ligature wire and has been in place for a very long time, with the eruption of the bicuspids and cuspids having caused extreme bends in the buccal segments. It looks like it is time for a new wire.